Fine. Today we will see about the topic called pre-vocational evaluation. So pre-vocational evaluation. So it is an assessment of an individual's ability to perform the work or the work-related task where they can adapt and they can make a decision making and they can go with the work in their work environment. These pre-vocational rehabilitation helps to determine the vocational potential and rehabilitation needs. So this is an important in physical, psychological, and social rehabilitation for an individual with any abnormality or any disability. So definition. So it is a systemic assessment process which is used to evaluate a person's functional abilities, interests, and work readiness before vocational placement. So objectives of pre-vocational evaluation includes the identify functional abilities and limitations, and also to assess work tolerance and endurance of an individual, and to determine vocational interest and skills. And after this, we can plan the rehabilitation and job placement for the individual, so that they will get an improved independence and employability in their society. So what will be the components of evaluation? So usually there will be a physical assessment, psychological assessment, social assessment, vocational assessment, and an environmental assessment. So we have to assess in the following these categories. So this will be the components of evaluation of the vocational evaluation. So in physical assessment, we have to check for the muscle strength and their endurance, the range of motion, coordination and balance of a person, posture and gait analysis, functional mobility assessment. In psychological assessment, we need to assess of the individual's cognitive abilities and also their motivation and attitude and their emotional stability in the society and their behavioral assessment so that we can know about their personal behavior and also the stress management ability. So after assessing this psychological assessment, we get a clear idea about the person's individual mental well-being. So in vocational assessment, the work skills and aptitude have to be checked, and we have to go for the educational background of the person. We have to check for the communication skills of the individual, and we have to check for the work habits and productivity of an individual. And then we have to go with the job interest evaluation of the individual, so that the person whether they can able to be continue their job or they can be able to adopt in their workplace or they are will be an not interested to work in that workplace. So that we can get an idea of pre-vocational rehabilitation for an individual in their vocational area. Okay. So work tolerance evaluation. So in the work tolerance evaluation, we have to measure for the physical and mental capacity of the work. Okay. So in that physical and mental capacity of work, so patient not only need a physical capacity, and also they have to they have to have the mental capacity as well. So if the patient having both physical and psychological capacity, well-being or well equipped, so that the person can able to work in their workplace without any discomfort or any distress or any psychological problems. And then we have to check for the ergonomics. In that ergonomics, we can go with the assessment of sitting posture, standing, lifting, carrying, and endurance of the person in their job environment. So whether it's a sitting type of job or standing type of job or lifting an object or carrying an object, or the person need more endurance for their job. And also it helps the individual to identify the safe work levels. So assistive devices and adaptation. So if patient need to get an assistive devices, we can go with the orthosis and prosthesis, adaptive tools and ergonomic modifications, wheelchair and mobility aids, workstation adaptation. So by making a changes in this one, we can make the patient to be adapt in their workplace itself. So role of physiotherapist, we have to assessment of the physical function, improve the strength and endurance, and go with the gait and postural correction if needed, and also go with the work conditioning program, and then patient education and counseling program if needed. So in-class assessment. So after the assessment, we have to know whether what will be the purpose of the pre-vocational evaluation. So what will be the functional capacity evaluation needed for pre-vocational evaluation, and we have to mention any two roles of a physiotherapist in vocational rehabilitation, and we have to know any components of pre-vocational evaluation. so that the class will be effective or not by knowing the answer from the answer. So in this main map shows the importance of the pre-vocational evaluation in the all the aspects, and thus we can able to make a clear or evaluated thing of this pre-vocational evaluation. Thank you.